Good morning, viewers, and we are back here on Youth Wednesdays. We start off, of course, with a very exciting interview for you this morning. We join with us this morning. I have Mrs. Achong, yes, Mrs. Martin-Achong, and also we have Mrs. Lezama-Clement. Good morning to you. Right, so Mrs. Martin-Achong is the director of F.U.N.D, and Mrs. Lezama-Clement is the co-director. And we are happy to have them in studio this morning. They're going to tell us a little bit about F.U.N.D. So good morning, ladies.
Good morning.
All right, so what is F.U.N.D? Who is F.U.N.D, and what are some goals and objectives of F.U.N.D?
Okay, so we are a group of nurses. We started our professional journey in 1984, and following qualification, a number of us dispersed to different corners of the globe.
Yes.
It was in 2018, I believe, we were on a trip to Europe, and we shared the idea of, giving back to our country. And so that idea started to realize. In 2019, we got together, we had a meeting, and it was a really revealing experience that some people were able to share their experiences of nursing in Trinidad and Tobago. And some of it was quite positive, but some needed much to be desired.
Right.
So, so that sort of started the journey for us. And we started the journey in looking at how we can improve the standard of nursing in Trinidad and Tobago. The onset of COVID has really created an opportunity because it opened the virtual platform to allow this to take place. And so we started that journey to become non-government organization. So we had 3 career events, and that was done in collaboration with the former nursing director, Miss Betty Ann Pilgrim. And we also had a laboratory webinar. There were 3 laboratory webinars where we looked at how you collect, store and transport specimen, and we know that is very vital in terms of diagnosis and treatment of individuals. So that was very productive. We had a lot of positive feedback from that, and we had also we attended leadership webinars and things like that. So that brought us up to the point where we are today. So we are celebrating, on the 4th of January, we celebrated 40 years.
Wow.
Not 10, not 5,
not 20.
Not 20, 40 years of nursing.
Let me just put in congratulations to you, F.U.N.D.
Thank you so much. Thank you so much. So we started this this journey about 2 years ago, the celebration, because we wanted, in the spirit of patriotism and giving back, we wanted to come home to our country and mingle with our society, but also to engage with some of the small businesses and things like that. So we have, I think it's about 15 in numbers now. By Saturday, we will have about 40 odd people and more. And so the celebration has already started. I don't know if Angelic wants to add anything else to that, but we are looking forward to an exciting time. And I'll tell you a little bit more about the project that we are running, but I don't know if Angie, do you want to add anything else?
Yes, I just wanted to add that F.U.N.D is an acronym for Friends United for Nursing and Midwifery Development in Trinidad and Tobago. Right? Because we want to, identify the gaps and see where we could contribute to improve the standard of nursing and midwifery in Trinidad and Tobago. Because collaboratively, we have a wealth of knowledge and experience. As Vita said, we have colleagues in Canada. Some of them came in from the UK, some from the US, and also other Caribbean islands. And we all, in senior positions. And we know that we can give back. We want to make a difference.
All right. Okay. So I see that you all are mentioning the fact that the body is made up of nurses, basically nurses in high positions, as you've just
senior
said.
persons.
Is this group open to any other person but a nurse? You know, members of the community and stuff like that.
Yes.
Absolutely.
Yes.
Because health, as we know, approaching healthcare, there are so many factors that contribute to health and determines a positive outcome. So we will invite, and I'll use this opportunity for anyone who would like to be a part of our organization to contact us on project F.U.N.D@gmail.com. That will be able to start to, they can contact us to let us know whether they're interested in joining us. We invite any professional, but even lay person as well, to be a part of this organization, because it takes a partnership approach in all different aspects, all different organizations to make this work.
And I love how you mentioned that there are different aspects of healthcare, because of course, I mean, you all come from the nursing perspective of it. We have a lot of other professionals in the health space that would experience different things when it comes to patients, but also we have to think about the patients that we have, you know, in terms of them coming and receiving that healthcare. As you said, that the motivation to start up this this project was to improve our healthcare system. So I really am happy that you all took this initiative. It's a very good one.
Thank you so
much.
much.
So what can we expect to see in the near future in terms of projects and stuff from you all? I know that you mentioned a lot of goals that you all have already achieved. So what can we look forward to, your projected ideas and your goals going forward, and any projects upcoming?
Okay. So during our time here in Tobago, we will be supporting one of an established nursing home. We will be providing some donations for that nursing home, which will help to improve the care that is delivered there. We did plan on having a health promotion venture at, I think it's Scarborough Secondary School, but because of the holidays, we had to cancel that. So that's still in our plan. And Angelic will ensure that that takes place in the near future. And the focus of that, you know, at our AGM meeting, we agreed to look at, in addition to some of those physical health issues, the comorbidities, diabetes, hypertension, cardiac problems, we recognize that domestic abuse is a real issue in Trinidad. It says that 1 in 3 women and 1 in 3 men struggle with domestic abuse. And whether that statistic is real, well, it leaves the question, but a lot needs to be done in terms of education. So part of that work that Angelic will be doing together with Maureen George, who is resident here and a nurse as well, and also Hyacinth Pollard Rodriguez, will be looking at providing a talk on domestic abuse, but it will be in a form of healthy relationships. So that's the Tobago aspect. In Trinidad, we are in the process of supporting the refurbishment of a maternity wing. It's a birthing room in that maternity wing, so that we can support that home birth environment. So the clients can come into hospital in a home setting, delivering their babies in comfort and style, and be able to go home.
I was just about to ask you what the difference between a home birth unit and the normal maternity unit. What's the difference, so that viewers understand the big impact that this will have for mothers who are about to give birth?
So
this was started because of the crime in Trinidad at the moment. Certain areas, it's difficult for the midwives to go home at these clients to do home births, for those who prefer a home delivery. So we decided, let's provide somewhere where they can come in but feel and look like they're in their home still. So this unit, we're going to provide like a bed that looks like a home bed. We're going to decorate it just how your bedroom would be at home. And we had colleagues who came in who bought Burton balls. We had some of them bringing Sonicates, blood pressure apparatus, all those different things, so that we will contribute that. We also will put a plaque saying the date and who it was donated from. So, and decorate it like your bedroom at home. So they'd come in, have their babies, and once they're okay and the baby's okay, they'll spend a very short time and then they'll go back home. So we want to simulate a home delivery environment. So that's the idea behind it.
Okay.
Yes.
This makes it more comfortable,
Yes.
I mean, yes, we know we have to go to the hospital and this and that,
Yes.
but it's nice to have a home away from home.
Yes. Yes. That's the
Especially
idea.
for
Yes.
something as special as this, bringing
Yes.
a new one into the world.
Yes.
I really love this idea. I do hope that, you all are starting at the Northwest Regional Health Authority first.
Yes.
First,
Yes.
I'm going to put in first because I'm hoping that you will come to Tobago
Tobago.
with this idea, right? I'm not there as yet,
Yes.
but I'm hoping that if I get there, that it will be nice to see a home birth suite.
Yes. Yes.
In a comfortable environment with nurses that pay attention, especially given the news and everything that we have going on right now.
Yes.
It will be nice to see an environment like that.
Yeah, thank you so much. Yes.
You're welcome.
Yes.
All right. So before we wrap up our interview this morning, could you tell our viewers where they could find updated information on these projects and where we can find more information on F.U.N.D 20 for persons willing to join?
Okay, so we are still en route to register as a non-government organization. So we do not have any established web page or anything like that. That's in the plan.
Right.
So once we complete our registration, we will be setting up our site. If anyone needs to get in contact with us, they can email us. We are hoping that we will be able to achieve, complete the registration by mid 2024.
Okay.
And following that, we will establish the website. So, but that has already been talked about and in the plan, initial planning.
All right. And you did say that it is open to members of the public and other healthcare professionals. So I think all-roundedly, as we're trying to make our healthcare system a better system all entirely, that I do encourage you all and invite you all to become a part of F.U.N.D 20. This is a great initiative, and I think it will be a benefit to us all on both of our islands, right? So we want to thank so much Mrs. Achong and Mrs. Clement for being with us here and telling us about F.U.N.D 20. Ladies, I do hope that you all enjoy the rest of the day. And to our viewers still joining us, I hope that you stay with us. And while we go on this break to come back, you share the live, share the live, share the live.